Modern life. Between careers, kids, and health, it can be mayhem. That's why we're here. I'm Dr. Lisa Varghese-Kroll.
And I'm Dr. Lonray Falusi. We're physicians, moms, and longtime friends who break it all down for you. Wondering how to juggle all the balls and still stay sane? Looking for advice but don't want to be overwhelmed?
Curious about how to make the most out of life for your family but enjoy it at the same time? You're in the right place. Welcome to Health and Home with the Hippocratic Hosts. On this episode, we give you the straight talk on COVID-19. What's the latest medical information and what's just mythology? What do you need to know to protect your family? And how do you stay informed without getting overwhelmed? The Hippocratic Hosts are here to help.
Hi, Lisa.
Hey, Lonray.
How are you?
Oh my goodness, making it through. How about you?
It's a homeschooling nightmare, but we're otherwise doing awesome.
We're in it together.
Oh, yes, we're in it together. That's right. That's right. So, as we have alluded to, we are really talking about COVID-19, coronavirus on this real first episode of ours. If you want to go back and learn a little bit more about who we are, feel free to listen to episode 1, which is about the two of us and sort of how we came to know each other, where this podcast started. But we wanted to focus this full episode on coronavirus. Our disclaimer right off the bat is that things are changing so quickly, so that by the time that you listen to this, some things could be out of date. So definitely always double check the websites for CDC, the Centers for Disease Control and Prevention, WHO, the World Health Organization, and your local government.
Absolutely. You know, we, when first kind of conceiving of the idea of a podcast, did not imagine that this was the first topic we would tackle. But once this came to the forefront of all of our lives, we felt like we really had an obligation to, to dive deep on this issue and, and give our listeners some real information that they can use. So we hope that this episode is useful for you.
Absolutely.
We're going to try to give you a broad look at all the different aspects of this pandemic. So, let's start from the beginning. What is the coronavirus? So basically, coronavirus is a family of viruses, and this family can infect both people and animals. And most coronaviruses just cause the common cold. They've been around forever, and, you've probably had one without even knowing it. But SARS-CoV-2 is a new coronavirus that was first identified in Wuhan, China in December 2019. And was officially named in February 2020. And that's what's responsible for the respiratory disease COVID-19, which is the source of this global pandemic that we're all experiencing right now. So why did this particular coronavirus wreak such havoc? Well, because this virus binds to a protein called ACE2 on the surfaces of our human cells, but it binds much more tightly than other viruses do. It's better at recognizing and latching on to human cells. And if it binds more easily and more tightly, you need less of it to cause an infection. So that's what's concerning about it. It's transmitted via respiratory droplets. So if an infected person coughs or sneezes on you, but it can also be transmitted if an infected person touches a surface, transfers virus to that surface, and then you touch it later. COVID-19 is a respiratory illness that can be mild to severe to deadly. Leading to pneumonia, respiratory failure, multi-organ failure, and death. And early symptoms to watch out for are fever, non-productive or dry cough, fatigue, and body aches. And a relatively early symptom can also be shortness of breath, trouble breathing. And if that's the case, if you experience that, that is a sign to seek immediate medical attention. Another early symptom that doctors and researchers are reporting is anosmia, or a loss of sense of smell and sometimes taste.
That one is just so bizarre to me.
Isn't it? I know. It's so interesting. And I think it's, it's rare enough that people are, it's kind of triggering people to think that maybe that is a sign that they've got it. But I think it's useful for us to know. And like all the other symptoms, none of these symptoms alone necessarily mean that indeed you have COVID-19, because they're all also symptoms of other things, including regular conditions like seasonal allergies or the common cold. And all of those things are still going around this year, just as they always are. COVID-19 didn't stop any of the regular stuff. So it's important to remember that. But the highest risk people are those who have compromised immune systems, who are over 65, who smoke, or who have diabetes, chronic lung disease, high blood pressure, or heart disease. Those are the ones that are at highest risk. But young, healthy people are also at risk of getting sick enough to require hospitalization, and some of them are at risk of death themselves. As well, while children are generally not a high risk group, there have been reported pediatric COVID-19 deaths as well. So this is something all of us have to take seriously. This isn't
Right.
some people's problem. Especially because one of the most important things to note is that carriers can be asymptomatic for an average of 5 to 6 days, but as long as 13 days after contracting the virus, which is part of what makes this so different and so dangerous when compared to other viruses, because you can be easily passing it on to others long before you know you have it. And it's because of this characteristic that the virus was able to spread so quickly around the globe. And due to a lack of testing, we don't know the true mortality rate at this point because there are many people who are positive that haven't been able to be tested. But it appears that the mortality rate for COVID-19 is around 10 times that of the seasonal flu.
Yeah, so that is really frightening. And as you just said, it's hard to really think about the numbers because we don't have great data in terms of how many people are actually getting tested. We don't have a lot of tests, I should say.
Right.
But we did want to kind of break it down in terms of who is actually getting sick. We will talk about how to best protect ourselves and to bust some myths. But first, let's talk a little more about who's being affected. So as of this recording, there are about 1.5 million confirmed cases of coronavirus in the world, with nearly 90,000 deaths, as reported by the WHO. And here in the US, according to the CDC, we've had about 400,000 cases of COVID-19 with nearly 13,000 deaths. So those CDC numbers, it's important to know, are either confirmed or presumptive positive cases. So since testing is not available everywhere, there is a concern that the actual number of cases is probably higher. So if there is any good news in that, it's that it means that there may be more people with mild symptoms who then recover more than we know. And that means that the actual percentage of people dying from COVID is lower than what we're currently estimating. But really, honestly, we can't talk about the numbers without looking at who is most affected. And this is what's super concerning. So early data are showing that Black people are more likely than other groups to become severely ill from COVID-19 and more likely to die from it. So for example, in Louisiana, Blacks make up about 32% of the total state population, but accounted for over 70% of COVID-19 deaths as of early April.
Unbelievable.
It is. And in Michigan, Blacks make up 14% of this total state population and have accounted for about 33% of confirmed cases and 41% of deaths. And this really pains me. And I know it pains both of us as physicians because it's not that we think that there's a genetic or a justifiable reason why one race would be more affected, but rather this is the effect of many things. So housing policies, for example, leading to lack of affordable housing and overcrowding and poor air quality that leads to worsening asthma. We also know that medical problems like heart disease and diabetes are more likely, or people with those medical problems are more likely to be very sick if they catch COVID-19, if they catch coronavirus. And those chronic medical problems are more likely to exist in communities of color due to issues like less access to grocery stores or to primary care, or even when people of color are able to access care, it often is lower quality care just due to issues that have been well studied, like implicit bias or full-on racism within the healthcare system, which no one is immune to. And thinking about, the majority of my patient population, immigrant families often have barriers to care, which we actually got a chance to talk about on the What is Black podcast. So thanks again to Dr. Jackie Duge for giving us that opportunity. So the point here is that the numbers are scary and that they're still climbing. And we really need to do a better job of getting testing sites and medical care to everyone without overlooking people who were already disadvantaged before this crisis even started.
Right, exactly. And just as you said, we had the chance to talk about some of these issues on Dr. Duge's podcast, What is Black, which was great. Thank you so much. And it's important to remember that this is sort of an example of how we're all one human race. This isn't something that's just affecting one group, because the truth is that the virus is traveling from group to group to group. Never before in human history, probably, has the entire planet been facing the exact same threat. So
Hmm.
there could be no greater evidence that we're really all in this together.
Absolutely.
So, knowing that, what do you need to do to protect your family? So, by now, the term of the year has to be social distancing, right? Like none of us even knew what that meant three months ago, but now we're all in the midst of it. So, of course, that means remaining at least 6 feet from other people, unless you live with them. And the reason for that is that any aerosolized droplets, droplets that go into the air from coughing or sneezing or even just talking, so that those droplets can't reach another person. And many local, regional, and other national governments around the world have instituted stay at home orders, enforced quarantine, or lockdowns. And while these are all actually legal terms and the legalities of them are slightly different, in essence, the goal is to keep people at home. For one thing, we're keeping potentially infected people away from vulnerable citizens that this virus could kill. And I think we all understand that that's one of the basic purposes of this order. But the other thing is that if we're not around other people, the virus can't find other hosts to infect and it'll eventually burn out. So, this prevents hospitals and healthcare systems from being overwhelmed with more patients than they have beds and ventilators. In other words, it helps flatten the curve. Now, every one of us has been touched by the negative economic effects of stay at home orders. It's triggered massive unemployment. It may trigger a global depression. We've all felt it. So, why are we doing this? Well, simply put, it's because if we don't, we will fill all our hospital beds, we will use up all our medical supplies, and we will burn out our medical professionals if they're not killed by the virus themselves. So there will not be adequate medical care left anywhere for people with any diagnosis, not just COVID-19.
Right.
So these stay-at-home orders are not an overreaction. They're the minimum that we must do to protect our fellow citizens and each other.
Absolutely. It's, as you said, we are all in this together. Literally, every single person is in this. So the decisions that we are each individually making about whether or not to stay home or to not wash your hands, it's not just affecting you, but your entire community. And considering how quickly the virus spreads, as you said, Lisa, right? It's really amazing how we can both positively and negatively affect one another so quickly.
Right, exactly. And I think in this time, it's important to focus on the positive sometimes because we do hear a lot of negative. So
Right.
yes, we have the power to greatly harm or even kill our fellow citizens by being careless, but we also have the power to flatten that curve and to save
Mhm.
lives that we may not even ever know about. So, one of these examples is the massive shortage of personal protective equipment around the world, PPE. So, as you may have heard, our healthcare workers are grossly underprotected. There are tremendous shortages of masks and gloves and protective gowns, and evidence shows that even for young, healthy people, mortality rates rise dramatically if they have repeated exposures to the virus. And that's what our healthcare workers are facing. They're repeatedly exposed day in and day out. N95 masks are the gold standard for healthcare workers, and those should not be used by the public. So, if anyone has a supply at home for whatever reason, contact your local hospital and arrange for safe drop off so that the healthcare workers that really need them can have them. The CDC is now recommending cloth face coverings for the public, and there are multiple cloth face mask sewing tutorials online, and we'll put some in our show notes online on our website. But it's important to remember that these are not substitutes for medical grade N95 masks. Those must continue to be saved for medical professionals.
Absolutely. Yeah. And, we also just want to say that when we talk about medical professionals, we are definitely talking about doctors who are intubating patients, nurses who are going in and checking vital signs, but also people who are drawing blood, people who are cleaning the rooms, our custodial staff, the
Exactly.
cafeteria staff that's bringing meals to people. So just remember that it's a whole community taking care of patients, and we have so many people who need that protection. And kind of even going back to the earlier point about disparities, a lot of those staff members are people of color. So I think also, we're still looking at the data, but some of those numbers around higher susceptibility may be because some of the frontline workers or other people who have essential jobs around in public service are people of color, are Black or Latino, and with that also are putting themselves at higher risk because they're being asked to as part of their job as essential workers.
Exactly. And imagine if any one of us is hospitalized, we would hope to have those services, right? We'd hope to
Hmm.
have meals delivered to our room. We'd have to hope to have a nurse to take our vitals. We'd hope to have a doctor overseeing our care. So if we want those services, then we need to do everything we can to protect all those people doing that. And one way is to reserve PPE for them. Another way is washing your hands, washing your
Hmm.
hands. And another piece of good news, since we do like to focus on good news as well, is that while there's no treatment and there's currently no vaccine, this virus is tremendously susceptible to something that we all have access to, and that's soap.
Thank goodness.
Thank goodness, exactly. So this virus is encased in a layer of fat, and that's something that soap breaks apart, rendering the virus inactive. And there's a reason that surgeons scrub so thoroughly before surgeries, because it dramatically decreases the rate of infection. So wash your hands often for 20 seconds at a time, scrubbing every surface of your hands. Don't forget your fingernails or underneath your fingernails or your wrists. You may have heard a good way to pass 20 seconds is to sing happy birthday twice. And if no soap is immediately available, then use hand sanitizer with at least 60% alcohol, although hand washing is always best. And don't touch your face, because the portals for the virus into your body are your eyes, nose, and mouth. And regularly disinfect surfaces, especially those that come into contact with items that have been outside your home, such as car keys and packages.
I'll say one thing I've learned throughout all of this is how often I touch my face. I
I
touch my face
know.
all the time.
Me too. Now that you can't do it, there's nothing
Yeah,
I want more than to
right.
just touch my face
Right.
for no reason. I know. And the other thing is how many things leave, if you think if you're sheltered in place that maybe not that much leaves your house, but oh my goodness, like
Hmm.
mail comes into your house
Right.
every day,
Right.
or like bags that you've taken to work or
Hmm.
something that water bottle from the
Yep.
car. So it's like really
Yeah.
thinking about those things is important, because that these little things, you never know what action could be the one that
Yeah.
save someone else's life.
Right. Right.
So, if you do happen to develop symptoms, stay home and treat them with fluids and Tylenol. Most people can recover on their own, and that means that you're saving our limited hospital resources for the people that really need them. But if you develop red flags, and those red flags are things such as trouble breathing, chest pain, confusion, or blue discoloration of any part of your skin, then you need to call 911, because that mean that you are one of the people that needs hospital services. So we want to make sure that we are using those hospital services for the people that truly need them, and the rest of us that we can try to recover at home.
Yeah, for sure. And we said earlier that so much is changing around
Right.
COVID-19. It's a brand new virus in humans, this particular strain of the coronavirus. And one of the good things, I guess, is that it's spurred on a lot of innovation within the medical community.
Right.
So a vaccine is hopefully in the works and being tested. Various treatments are being looked at. So we wanted to talk about what are some of the latest developments or questions that people may have about sort of treatments or other issues within the medical community. The first one being NSAIDs. So these are non-steroidal anti-inflammatory drugs, NSAIDs. Things like ibuprofen, which comes in brand names like Advil and Motrin, very commonly used medications. If you have a headache or pain or fevers, people will often take NSAIDs. There's been some concern that taking these might cause more severe illness if someone does have COVID-19. But this information is so early and it's so limited. So
Mm-hmm.
at this time, the FDA and the WHO are not advising specifically against taking NSAIDs, just because there isn't enough data to tell people to stop taking the medications.
Right.
Also, there are some conditions where people have to take NSAIDs every day, like some of the kids I see with a childhood form of arthritis or people who have chronic pain syndromes. So if that includes you, the best advice that we can give really is to contact your doctor or healthcare team and talk to them about your specific situation. They might recommend holding off on your NSAIDs until we know more, or they might say that it's actually better to continue taking them, and we'll keep looking at the data. But for each person's individual situation, really, talk with your doctor or healthcare team.
Right, exactly. It's, right. The situation is so fluid. And so the recommendations based on our very limited data will change, day by day as data changes
Right.
and as data increases.
Right, right. And then similarly with hypertension meds. So high blood pressure is one of the most common chronic illnesses in the United States. And there's been some concern that taking medications for high blood pressure might increase how susceptible you are to COVID-19 or how severe it is. But three major medical organizations that include cardiologists and heart failure specialists have said actually continue your antihypertensives for now, especially since high blood pressure itself can be so deadly.
Right.
So again, kind of talking to your doctor if you're concerned. But for now, the recommendation is to continue those medications. So the big one I would say is this question about chloroquine or hydroxychloroquine, which goes by, or at least hydroxychloroquine goes by the brand name Plaquenil. Um, there have been some promising early findings that these medications can lower the risk of having severe illness from COVID-19. The FDA has approved these medications for some conditions, like chloroquine is often used for malaria and has been used for decades. Hydroxychloroquine has been approved for conditions such as lupus. But we really want to be clear and say that as of right now, these medications are not FDA approved for COVID-19. So several studies are in process, and this process needs to happen. The reason that we do drug studies is to make sure that the drugs help, but also that they don't have serious side effects. So we don't sort of just like kind of willy-nilly try medications that are
Right.
not FDA approved, especially medications like these that are pretty strong medications
Right.
as they're combating pretty strong conditions like malaria and lupus. So medical experts are definitely discouraging people from taking these medications without guidance from their doctor because they can cause problems like heart rhythm issues and have had other side effects among some individuals. I mean, it's really sad. People have actually died trying these medications just kind of on their own, without a prescription or without guidance for their specific condition with COVID-19. So just kind of being careful and judicious. Let's see how the studies come out. Some people are being helped by it, which is very encouraging. But there is a process that we follow within healthcare to make sure that medications are not just effective, but that they're also safe.
Right, exactly. We need to honor that process. We're lucky to have that process in place because it's protected us. And it's also important to remember that, not only are these medications not FDA approved for COVID-19 yet, though they show promise, hoarding them or using them can actually prevent other people who are
Right.
using them for autoimmune diseases such as lupus not to be able to have access to those medications, and they may need them to be functional,
Right.
and to be able to fight off the virus if they should come in contact with it. So it's important to remember that as well.
Exactly. Exactly. So again, we're all in it together. So remember your fellow human as we're hoarding anything from a toilet paper to Plaquenil, right?
Right.
So the bottom line here really with medications is that if you have questions about your medical condition or any medications that you take regularly, then just contact your healthcare provider, kind of talk through your situation. There's no blanket answer for every person. But hopefully, if you have a primary care provider or a specialist, they can guide you through that. And if you don't, then there are other options potentially in your community around with community health centers or with your health department.
Right, exactly. Every human is an individual. That's why medicine is a very complicated
Right.
field. So always check with your own provider. So, okay, Lonray. So now the interesting part
Oh, yes.
of this episode, which is addressing the myths. We have seen some crazy myths out there, and my
Mhm.
goodness, it would take 3 episodes just to address them all. So we've just
Right.
picked out a few of the top ones, but it is really important when facing something like this, where one person's actions can affect so many other people, that we are operating from a fact-based point of view. Our worldview has to be based on science. So we wanted to pick out a few of the craziest things that we've heard and talk about, what the truth is. So one of those myths that we've heard a lot about is the myth that drinking hot water or going to a hot climate will kill this virus.
It
So
doesn't?
keep listening, Larry. So, first of all, countries with hot climates have this virus. This virus has spread all over the world. The virus is present everywhere. The temperature of the climate does not affect the infectious nature of the virus. Now, there is some thought that as summer approaches in our hemisphere, that we may see a drop in the penetration of this virus, much as we do with the flu, and that is something that we may see as summer approaches. but it doesn't mean that a hot climate kills the virus. There are multiple other factors that work into that. And also, it's important to remember, too, that this virus is not actually alive. It can only be deactivated, not killed. But going along with that, the temperature of anything that you eat or drink will not affect this virus. Anything that you ingest into your body, it may cause temporary fluctuations in your temperature, but ultimately it's converted to body temperature.
Right. Second myth, and actually I should say these aren't even the craziest ones. We're not even going to talk about like 5G and how 5G does not cause COVID-19 and all that. That doesn't even merit
right. We assume that most people know the craziest things are not true.
Yeah, hopefully you guys have looked into some of those a little bit. But nasal rinses, that is one that I've been asked about. So whether rinsing out your nasal passages with saline or salt water, if that helps to protect people against infection. So there's actually no evidence that regularly rinsing the nose with saline would protect people from infection with the new coronavirus. I think this question comes up because there's some limited evidence that doing that can help people recover more quickly from the common cold. Right. And we've all probably experienced this. You get really stuffy. So using a saline nasal spray, which we often recommend for everyone, kids to adults with colds, can help you start to feel better. But it's never been shown to prevent a respiratory infection. So if you feel like you need it, there's not a reason not to, unless you have your own particular medical reason not to use saline, but don't expect that it would prevent you from catching coronavirus.
Right, exactly. Next one is garlic. Garlic, listen, it's a great food. I love garlic, right? Like I don't cook anything without garlic. It's very healthy, but there is no evidence that garlic deactivates this virus. And like these other myths, they often come from some kernel of truth. And so this may have started because garlic does potentially have some antimicrobial properties, which is why it's a healthy food and it's great to eat. No reason not to eat it. But there is no link between garlic and recovery from COVID-19.
Right, which is too bad. Otherwise,
it really is. I would be immune.
completely. And then our fourth and last myth is about multivitamins and other kind of supplements and antibiotics. So first with antibiotics. So as a reminder, COVID-19 is caused by a virus. So antibiotics won't actually kill or affect the virus in any way. Since it's not bacteria, but these are viruses that we're talking about. There are people who have been hospitalized with COVID-19 that have been prescribed an antibiotic, but that's more so because you can have a bacterial pneumonia, for example, at the same time as this viral illness. But the antibiotics themselves are not really for deactivating or killing a virus. And then multivitamins and other kind of supplements that people may take to try to improve their immune system. So yes, there are some parts of the immune system that require vitamins and minerals like vitamin A, vitamin C, and zinc to function normally. But we have this as a myth because higher doses of these and other vitamins or supplements have actually not been shown to make the immune system function any better. If you're not getting the range of vitamins and minerals that you need from food, it's possible that taking a multivitamin is a good idea, but beware about those with like high doses, because those can actually interfere with the medications that you're taking or may be harmful to your liver or to your kidneys. Or at best, like your body just realizes that this is more vitamin C that we need, so you just urinate it out. So this ends up just being kind of like a waste of money if it's not harmful at these very high doses. But generally, it's best to focus on a healthy diet, which means filling half your plate with fruits or vegetables, having healthy proteins like lean meats or beans, and eating whole grains. But if you are not able to have a balanced diet, then again, multivitamin may be a good idea. But if you have questions about that, of course, talk with your doctor, your healthcare provider for some more guidance.
Exactly. And food is medicine.
Right.
The best that we can do, and obviously we're in a crazy situation right now where it may be challenging to get to the grocery store often, but the best that we can do is the best that we can do. And food is the
Right.
place to start. So, how do you avoid panicking or causing anxiety in your children, which is even worse, right? Like I think we've all kind of faced this. Our kids definitely know
Hmm.
something's going on because they haven't been in school in a month
Oh
or more
yeah,
than
my
that.
daughter FaceTiming with her fellow 4-year-old friend, and they're both like wanting to have a real play date together. But then I hear, but because of coronavirus, we can't have play dates until people stop coughing. Poor things. They're just like, they're really, really in this.
I know coronavirus is part of my kindergartner's lexicon. It's just a crazy
Hmm.
time. Like, never would I have predicted this. So, it is, the truth is, we all live in this world and there's no way to shelter them completely. But how do we prevent this time from becoming something that has really triggered severe anxiety in us or in our children? Well, number one is probably to limit media intake. So that doesn't mean being uninformed. I think Lon and I would both say it's very important to be
Right.
informed and to be aware of facts. Like we both really value facts and science. So that is not what we're saying. But designate a time during the day when you are going to read the headlines. You're going to read the news, you're going to learn what's happening in the world, and then shut it off. Learn for yourself how much you can take. Some people can check it 3 times a day, some people can only check it 1 time a day, whatever it might be for you. But stick to those times, and in between, move on with your life. Do the other things that you need to do rather than marinating in all the bad news that there is around the
Hmm.
world, because there is a lot of suffering. And that suffering, the world's suffering is not meant for any one human's shoulders. It's too much for any person. So it's important to really limit the amount of news that you consume to a specific time. And then next, we would recommend maintaining a routine. We know that for children, they really derive a lot of security from a
Hmm.
routine, even outside of a global pandemic. So, how much more so during this crisis? Even if your children are not in school, as most children aren't, make sure that you're sticking at least loosely to some sort of schedule, that everybody is getting up at a relatively regular time, that everyone's having meals at a generally regular time. Don't spend weeks in your pajamas. That the kids are doing their schoolwork in a designated place at a relatively regular time, and then maintain your spiritual life. If you're part of a faith tradition, maintain that. This is a time to derive strength from that. I know that we have. For us personally, we've been able to attend our church online, and that's made such a difference. And it really can be something that's very grounding in a time that feels anything but grounded.
Right.
And then maintain your exercise and sleep regimens. As much exercise as you can get when you're sheltered at home, the better. So even if that means doing 10 laps around your yard, which might not be very much space, or walking up and down your block, whatever you can do while maintaining 6 feet distance from anyone around you. Because the more exercise you get, the better shape that your immune system will be in if you do have to face the coronavirus. And sleep is the same thing. Try to limit the amount of stress that you're taking on in order to still get as much sleep as you can, so that your immune system will be primed if it's called to fight.
Right. And these are so important. And we totally understand and feel ourselves too that sometimes this is all easier said than done.
Absolutely.
Yeah. And I think what we like, our key here is just do the best that you can. There
Totally.
will be the days when like the routine gets turned upside down and then you see how tomorrow goes. Or, you
Exactly.
may not get that like great sleep or that great exercise, but we don't beat ourselves up over it. Just kind of see how the next day goes and keep trying our best.
Totally. As Laundry said, this is a no judgment zone. So these are
Right.
not meant to make anyone feel guilty. They're just standards that you can try to achieve. And when one day's done, you just start over the next day. And we just keep
That's
trying
right.
to do better. That's all we can do. And it's the same principle that when you're on a plane, you put your own oxygen mask on first. You've got to take care of yourself if you want to be a good parent or a good spouse or a good worker, if you're still fortunate enough to be working at home.
Hmm.
Um, or if you're a frontline worker. There's no way that you can help other people if you aren't in some way filling your own tank. And again, that's not meant to make anyone feel guilty, because we know exactly how hard that is right now. But if it comes down to letting your children have a little screen time so that you can take a nap or take a walk in the yard or whatever you need to do to fill your tank, then that's what needs to be done. Put your own oxygen mask on first so that you can be there as much as possible for the people that are relying on you.
That's right.
And then the other thing that we would suggest is looking for ways to help others. In this time when we're all isolated, it's very easy to, curl in on ourselves in our own cocoons. But knowing that we're helping others get through this global crisis can really help our spirits, and can help our communities. So some of the ways that we'd suggest would be, an easy way is donating money. If you're fortunate enough to have some extra that you can share, donate it. There are tons of places online. Checking on your neighbors, especially those who are isolated and may not have family that can check on them because of the isolation. Buying groceries for either elderly residents who really should stay out of the grocery stores if they can,
Mm-hmm.
or for food banks, which are facing critical shortages now that there are so many people who can't work. Sewing masks. As we said, masks are best for the public, not for healthcare workers, but there are some hospitals that are accepting cloth masks if their supplies of N95s are getting really low. And there are multiple tutorials online, and we will share one in our show notes. Supporting local businesses. So for restaurants, that may mean either ordering takeout or buying gift cards for when things are better to help tide them over financially now. Donating PPE if you have it. There are many people who had N95s in their homes for craft purposes or construction or whatever else. But if you have some, donate it. There are so many medical offices and hospitals and community centers that could use them.
Yeah.
Another one is to donate blood. If you're healthy and able, the American Red Cross that's another place that's facing critical shortages. And one of the things that we're finding with COVID-19 is that there's an element of anemia that might be involved in the respiratory failure that ensues in many of our patients. So blood donation is even more important. And this is a time when we can really help that shortage if you're someone that can donate. And lastly, do not hoard. Do not contribute to the toilet paper mania that's going out
Oh,
there.
goodness.
It's crazy. I mean, hoarding is definitely a vicious cycle. So when one person hoards, the next person sees it
Mm-hmm.
and thinks they need to do the same. But what happens is, of course, that the most vulnerable are the ones that are left without. So whatever it is, whether it's groceries, eggs, toilet paper, hand sanitizer, take enough for your family and leave the rest for someone else. If you have a store in your home, look for someone to donate that to. And remember, lastly, through all of this, we're all going through this. Remember that some of the best of humanity is brought out by the worst of crises.
I love that.
Mr. Rogers, right? He was the one that said, look for the
Mm-hmm.
helpers. And
Mm-hmm.
I have to say that as sad as all of this has been, and the news that we read, and then the personal stories that Lonry and I have been privy to, there have been many stories where I've just been so proud of the human race, I have to say.
Oh, yeah.
And I'm really, really just moved by some of the stories of love that I've seen. And those stories are there for when we're feeling really low. And so remember those and read those when you need to.
Yeah, definitely uplifting, right?
Mm-hmm.
As partly as a distraction, but also just to remind yourself that it's not all bad out there, and there's some good that's being brought out of people even in all of this, and some good that can be brought out of us.
Exactly. So, Lonry, what is our Dr. Mom life hack of the week? This is a good segue to that. What can we do? What can make our lives a little easier?
What can make our lives a little easier? So here is our Dr. Mom life hack of the week. It's not that easy coming up with the hack of the week based on COVID-19. But we did it, y'all. Yes. So this is actually an idea that originated with a teacher in Missouri. This is before schools closed, obviously, but to encourage her students to wash their hands, she had a little stamp that actually had her name on it and would stamp the back of their hand every morning, with the goal that that stamp should be faded or gone by the end of the day after they've been washing their hands a lot. So if at the end of the day that stamp was still there and legible and clear, then that kid definitely did not wash their hands enough. So what she was finding was that through the day, it was this like great visual reminder for the kids. And she even did it herself, to like keep washing your hands until that stamp really faded.
I love that.
I know. And we all need that visual reminder because it is easy to kind of fall out of these habits, right? And she would give the kids prizes at the end of the day if the stamp really was like faded or gone. So this is something that you could consider if you have kids, to do with your kids at the beginning of the day or for yourself. If you don't have a stamp, she just had one of those stamps that like you might use, to stamp a sheet of paper that had with her name. Or if you have a stamp that you have for your return address, for envelopes, or even just honestly a pen or a marker. And draw a smiley face on the back of your child's hand, or a check mark on the back of your hand or something, just as a reminder to keep washing your hands throughout the day. And kids, they're not going out as much now that schools are closed and community activities have, more or less stopped. But this is still good advice, since likely someone in the home is still going out, either to work or for groceries or for exercise. And kids and adults, right, are always touching their faces. So that frequent hand washing is still needed at home. And even after this pandemic kind of subsides a bit, it's still a good habit to have, to frequently wash your hands, whether it's coronavirus or the flu or the common cold. There are reasons that we want to make sure we keep our hands clean. So try that out. We'd love to hear if you guys do, and how you find it, and if it helps as a reminder to keep washing your hands, or to remind your kids to wash their hands.
Exactly. So that was our take on the coronavirus and COVID-19. We hope that we gave you some useful information that can help decrease stress and help your community and your loved ones. And thank you so much for listening. We appreciate you so much. And please join us next time when we talk about work-life balance.
Mm-hmm.
Why is it important, and why is it so tough? And how do we go about finding it?
I can't wait to find out.
Talk to you then.
Thanks for listening to Health at Home with the Hippocratic Hosts. Remember that all views expressed here are our own, not our employers, and all content is for informational purposes only and should not be construed as medical advice, nor the establishment of a doctor-patient relationship. Always consult your own physician or healthcare team for any medical issues.
If you enjoyed this episode, please rate us, subscribe, and tell a friend. And check out our website at www.hippocratichosts.com for show notes on this and all our episodes. Can't wait to chat with you next time.